So you'll very seldom see me overarch, because immediately I get feedback from my body saying, oh, that's a bad place, don't go there.
Yeah.
The biggest thing that I wanted to focus on with you when you came in was that there was no notification to you to say, hey, we've gone too far. You're not allowed down this road. You need to come back, right? And we would just keep going down that road. So what we had to do was build in those tension points for you and create them for you so that you understood where they were. And now you know where to go, because you've taught your body that, hey, this is the tension point that I need to get to.
Hey, I'm Hypermobile, and if you're listening to this, I'm guessing you might be too. Hi, my name is Alex, and I'm your Hypermobile host, and today we have on Sean Thompson. Sean, thank you for being here today. I'm so excited to have you on. You're a level 2 CrossFit trainer. You are my coach, actually. We've worked together since April, May, something like this. May. Yeah,
it's been going well.
It's been going fantastic, actually. But you are my coach, and you're someone I would consider you a movement expert. We've talked a little bit before this episode about some of the things we're going to touch on. For me, this episode is really for that person who is just struggling to make progress in the gym. So going back to my kind of personal situation a little bit, when I was really, really struggling in my early 20s, I was just trying to figure out like what I could do to make some progress and find a way to do a little bit more than I could do the previous day. And although you yourself are not hypermobile, you seem to have a very good understanding of tension and body position, and that's kind of informed a little bit of how you've worked with me.
Yeah.
So Sean, tell me a little bit about yourself, because I know you had a point in your life, you were quite sporty, doing rugby and different things, and then some health issues happened. Tell me a bit about those.
I've been playing sport my whole life, and in 2015 I was diagnosed with testicular cancer. Fortunately caught it quite early. Had an operation to have my right testicle removed, so I didn't have to worry about that anymore. Doctors suggested that I go through chemotherapy, which I did. That was about what was supposed to be a 6-week process, took about 8 to 10 weeks, because it was during winter. I got quite sickly. And obviously they can't give you treatment when your white blood cell levels are too low. Yeah. So I came out of that very weakened, which for me was it was a very different place to be, having been such a sporty kid and always involved in sports. At that time, I was involved with a CrossFit box. I wasn't a coach or anything yet. I had coached schoolboy rugby and rowing. But at that point, I was just an everyday member. And I slowly got back into training a little bit myself at home, getting comfortable with moving again. And then I finally made my way back into my CrossFit box back then. And they really helped me to get back to a level where I would say probably post 2015 is some of the fittest times I've had in my life. So that was kind of the big struggle that I went through there, kind of always being at a fairly high level to, remember kind of rolling over in bed and being out of breath or walking upstairs, which gave me a new, I would say, perspective on kind of what it actually means to not be the fittest or have to struggle with certain things that I had never experienced before. So it was a big learning curve for me.
Yeah, I think it's hard, especially too when you're a relatively young person. How old were you when you were going through all that?
23.
23.
Yeah.
So you're going through something. I'm guessing you didn't have many friends going through the same thing at the time as well, or perhaps you did. I don't know.
No, it was quite a shock. When I used to go for treatment, I remember whenever I'd be in the treatment room, I was the youngest by far, and I think in my 4th week of treatment, there was a younger gentleman who actually ended up coming in, and me and him had a little bit of a chat. But when you're there sitting in the treatment room having your chemo come through, you end up talking to a lot of people, and even the kind of older population, some of the older gentlemen that I was speaking to were so shocked that I was there. And I think that was one of the hardest things about this that had gone on. I never thought I'd ever have to deal with anything like that. So it was quite a jarring experience for me, but in the same sense, having come through it, I think I learned a whole lot about myself, and just also the type of things that people go through, and just being compassionate and understanding of how we can help anyone in any situation. You know, I think when I was going through the treatment, I never thought that I'd be fit again or be able to do the things that I did. And 3 years past 2015, you know, I was the fittest I had been. I had got further in sporting events than I had before, which was really great. It was really uplifting for me. And I think that's kind of why I then decided that coaching was something that I wanted to do in life, to make a little bit more of a difference.
Yeah, no, absolutely. I can see that in my work with you as an individual, but also in your discussion kind of how you approach things more broadly. It's clear that you have an understanding of what it's like to be in that kind of dark place. And we've talked about that a bit with like my experience when my body was not working well because of my connective tissue disorder, and having to just kind of claw back that progress. And I think what must have been difficult in your situation, at least I know it was hard in mine, is like you, I did childhood sports and I was fairly athletic, and you go from having a body that can do lots of things to having a body that can't do, much.
Yeah.
And the psychological shift, whether it's someone dealing with cancer or whether it's someone dealing with hEDS or HSD or another health issue, is hard. Can you tell me a little bit more about how important or maybe not important exercises for your mental health? Because for me, I can say certainly it's how I always tell you when I see you, this is the happiest hour for me. You're like, how are you, Alex? I'm like, I'm so happy to be here. This is the happiest time I have. So tell me a little bit about kind of how exercise affects your mental health, or what effects you feel like it has for people more broadly.
I mean, for me personally, exercise is really important. It really helps with my own mental health. I do have struggles every now and again. And I find moving and just allowing myself to move, almost switch off sometimes. We always talk about kind of when you're doing your steady state training, how much you love it. You kind of just zone out and you almost go to your own world. And I think fitness for me does that. And it's really important. As a whole, for people just in general, I think it's hugely important. One of the things I strive myself on it as a coach is giving people the best hour of their day. So when you come in and you say, oh, this is the best hour of my week, it's really great for me, because that's what I want at the end of the day. Obviously, we want to be progressing you with your gymnastics training and getting you to the point that you want to. But the fact that you're coming in and you're having a great time and it's something that you look forward to, I think is really important. We all live very busy, stressful lives. So if we can have an hour a day, an hour every second day to ourselves, where we get to focus on ourselves, because that's what it is, right? When you make the conscious decision to train for a certain amount of time, you're taking the decision to put focus and energy into yourself. And I think that's important in a world where so much focus and energy is demanded of us. We have to kind of fill our own cups sometimes, and I think exercise is a great way to do that.
No, I fully agree. And that quiet place. And again, I love everything. That's my problem. And I know there are some people listening to this who just don't like exercise, and that's okay. We don't have to all like the same things. I always try to help my patients find what they hate the least if they don't like exercise. But if you're someone who does, certainly it's like that safe refuge. Sometimes getting to that quiet place where you're just kind of doing something that feels good for your body, and that chance to switch off, as you said. In terms of gymnastics, we have to touch on that, because people hear Alex, you're doing gymnastics, and people think I'm doing, I don't know, flips and this and that. It is not that glamorous. And I've had kind of a bit of an atypical fitness journey, and we can touch on that in a minute. But before we do, can you explain a little bit what we're actually doing with me?
Yeah, I mean, so the gymnastics that we're doing to you, to explain to everyone, is a little bit more kind of positioned to allowing you to get more out of your functional fitness. So we're focusing on things like pull-ups with assistance, which is what we would call a kipping pull-up, where we're using the full body to assist us in getting that pull-up. So we're taking principles from gymnastics and we're applying them to the fitness world to allow us to kind of get more power output from a workout. Because if I can do more pull-ups in a shorter amount of time, I'm technically producing more energy, which is great for me to get fitter.
Yeah. No, it's been great working on those like specific skills with you, certainly, and having that progress. And I think as someone who's a patient myself, as well as a healthcare professional, for me, it's always been critical to have goals that are outside of just like doing something so I can feel better.
Yeah.
Like I find that kind of depressing, to be honest. But I think going back to kind of where we started out as well, it's been really about generating tension and feeling tension.
Yes.
Because some people will be listening to this, and look, I know that everyone's body is different. There are people where doing certain sports or certain movements absolutely are not safe for them, and they should not do it. I have some patients who have frequent shoulder dislocations and other things where we would not want them to be swinging off bars, for example.
Yeah.
But in my situation, it's been really helpful thinking of different ways to develop muscular control in my hip flexors in particular.
Yes.
And in my kind of interscapular region, or my, my thoracic spine, if we call it that, kind of my mid back. I feel like that's been a huge focus of our work.
Yeah, I think when you came in, obviously I coached you in situations in group classes.
Yeah.
And you wanted to get better at your gymnastics. And the very first thing I was like, tension.
Yeah.
We need to find a way to help you understand how we should be generating tension in the body. And I think one of the most interesting things about our journey together is, because of the hypermobility, is finding ways that we can allow you to do that, right? So obviously we started out with the hollow hold, where we had feedback from the floor constantly to let you know that you were in that position, versus putting you on a rig immediately and asking you just to find this tension with no feedback at any point, right?
Yeah, while hanging, which is not easy to do.
No, of course. And from the times that I'd seen you in classes, I could see that you had a little bit of tension in your shoulders, probably from your swimming days.
Yep.
But it was more the midline where I think I started my attack. And we have constantly kept getting after the midline and strengthening the hip flexors as we go.
Absolutely. I'm one of those people too, and I'm just saying this again in case there are listeners who kind of have similar situations to me. I'm one of those people who was able to do lifts like a snatch, or kind of these really advanced things to a pretty reasonable weight, but I would struggle to do a hollow hold off the floor. Like I could hold it for like 1 second maybe, and I'd get really bad neck pain, and it would always irritate my symptoms. So we really took it back to basics and had me in like, and I wish people could kind of see a video of the sessions, especially the first ones, because again, people think it's cool, and like if I share stuff, I tend to share the stuff that looks a bit cooler, but I was mainly just lying on the floor trying my best to like hold a position. It's not been glamorous. I will say in terms of working with a personal trainer or a coach, you mentioned the word coach earlier. I think it came up in the introduction we were talking about it, or maybe it was before this episode when we were talking. Tell me a little bit about that, because I think it's an important subject.
I like the word coach.
Yeah.
I prefer if people call me coach.
Yeah.
I'm not saying people have to call me coach, but if you're talking about what you did with me, I don't like it when you call me your personal trainer. Yeah. I just find the word personal trainer, it's kind of like, oh, you're going to come in, I'm going to tell you what to do. Yeah. You do it for the day, you go home, you don't think about anything, and you come back in a week's time or in 2 days' time and we do the same thing again. I feel like a coach is a far more collaborative idea. You're going to come in, we're going to talk through the things that you are struggling with and how we can work together to get the best result for you, right?
Yeah.
And kind of not looking at you as just a oh, this is a person that I need to get fitter, but what are the things that are really going to make a difference to Alex so that she doesn't have to keep coming back to me every week. And we get to a point where she feels comfortable enough and I've left her with enough knowledge that it's like, Sean, thank you so much. I appreciate it. But, I'm now going to continue my fitness journey on my own, right? And, that's kind of what I used to get from coaches at school. They would help you with a skill as you would develop through the age groups, and you would move on to the next coach who was going to teach you, harder things or more difficult skills. And I feel like, don't see me as a personal trainer, see me as a coach who's going to work with you to get your toolbox ready so that you don't have to keep relying on my tools.
Absolutely. And I think that idea of having a longer view in mind is key. When it comes to you as a coach, for example, say that in 2 years I've mastered whatever I want to master. My back is now bulletproof. We'll talk about the back injury. I've been dealing with it a sec because that's been a nightmare. But I know like in some cases you might be like, Alex, like you want to see this specialist coach for this reason or whatever. A good coach, they have that view in mind and help people access what they need to, I guess, to progress. And it's that it really comes down to caring, I think, at the end of the day. In terms of, let's talk about kind of CrossFit for a bit, because it's played an important role in both of our journeys. And I know that there's like CrossFit, the business or the brand, but if we take away kind of the CrossFit brand for a moment, what else can we call it? Like I jokingly call it Alex Fit when I just do my weird stuff by myself. Yeah. Please don't sue me, CrossFit. But what else can we call like this type of training?
I mean, if you look at the definition of CrossFit as CrossFit as a methodology, it's constantly varied high intensity functional movement performed over broad time and modal domains. So, if we want to give it a different name, it's mixed modal training. Yeah. And making sure that it's not just the type of training I'm doing, but the amount of time I train for. Sometimes I'm going to train for 5 minutes and it's going to be a short, aggressive workout. Sometimes I'm going to train for an hour where I'm sitting on the, rowing machine and I'm just kind of working on my aerobic capacity. Yeah. And sometimes we're going to be right in the middle where it's maybe a 15 to 20 minute workout.
Or even doing active recovery. Exactly. People forget about how I'm a big fan of recovery. Yeah. No, I think for me, that perfectly sums it up, to be honest. But what helped me so much in terms of my fitness journey was kind of stumbling upon CrossFit. So early on in my career, I was working with some professional CrossFit athletes. At that same time, I didn't have the money to access a coach or anything. I couldn't even access really like regular gym classes. So I just found this local gym and I would go and just make my own little workouts. And I would really just try to find things that didn't cause me pain. Which is kind of a weird trial and error system, but I'd be like, can I squat today? Can I do like a shoulder press or whatever? What can I do? And then I'd try and just do something, whatever I could with what I had. And when I started to learn about kind of mixed modal fitness or CrossFit as I was working with at the time, what I found so helpful as someone whose body would hurt from doing weird things was the infinite variety of movements. Yes. Like there is, people say to me like, Alex, what's the best exercise for hypermobility? As a broad term, like, is it Pilates? Is it like strength training? What's the best? The truth is there is no singular best type of exercise. And what's ultimately not worked for me has been limiting myself to one thing, because I would start to eventually, do too much of it and overtrain with that one thing. And I would, it's like my body would get injured, or almost in a sense, you can think of it as it getting sick of it. Yeah. You can't live off the same food every meal for years and years and years. It's what I tried to do when I was swimming so much. And that's what led to a lot of the injuries and different issues I have today. So with CrossFit, I know what helped me certainly was having just this variety to look at. Should I do, as you said, some steady state training, some, Turkish get-ups, there's every movement imaginable under the sun. How did scaling help you when you were kind of digging yourself out of that hole back when you were dealing with recovering from cancer?
I mean, just kind of scaling is a tough one when you enter a room and you're not used to doing that. It can be kind of ego driven a lot of the time, and you start to think, oh well, I'm not doing what everybody else is doing and those type of things. But when you look at it for what it is, which is we're modifying the workout for you, or modifying the movement or whatever it may be, so that you can continue to move and perform and get the stimulus that we're looking for. It really helps you to understand that, what this is actually doing is just allowing me to move again, So I mean, I remember when I came back from my cancer, I had written myself up a workout which was very basic and simple, and it started with 10 knee push-ups. From the 10 knee push-ups, I then did I think it was 10 alternating lunges, which in the beginning was a little bit too difficult, so we had like a little step onto our outside patio. So I started with 10 step-ups onto that. And then I would walk the length of the garden, come back, and I would do that again. And each week I would try progress and be a little bit better. So, eventually after I'd done that for about 2 weeks, the knee push-ups started turning into 5 normal push-ups and then 5 knee push-ups. and the step ups onto the patio turned into lunges, and slowly just started bringing myself back that way. And then when I was in the gym and it became kind of more technical things, looking at the lifting again, starting to get my cardio back up, maybe intenser intervals on machines or running, or mixed modal stuff all put together, I had the guidance of a coach there who would help me and say, look, Sean, you've just come back. It's been about 4 months. Let's take it a little bit easier. And that guidance really helped. It just kind of let you know where you needed to be.
It helps hugely. It's why I'm so happy now I'm in a position where I can have some external guidance, because being your own coach is really difficult. And that's what a lot of, listeners ultimately have to end up doing, is trying to be their own coach, either because they've tried to access support and they can't find anyone who really is able to support them, or, they're just they're unable to access support for whatever reason. When it comes to hEDS and HSD, I have to talk about the health stuff for a sec. Again, I always forget to do the medical disclaimer. It's in the text, okay? This is not medical advice in any way, shape, or form. You need to talk to your appropriately qualified medical doctor or healthcare provider for what's right for you. But when it comes to hEDS or HSD, I find a lot of people get very nervous about whether or not it's safe to exercise. And that nervousness it's very reasonable, because some people can have very serious ways in which they are affected. I don't recall if you remember when I first met you and I said, hey, like, I can't be upside down for too long because I'll start to get burst blood vessels on my face.
I do recall this.
Yeah.
I was very nervous.
And I have to be careful with pressure in my eyes as well, because I have a history of eye surgery there. So we do some upside down stuff, but we're careful with the time domain for that. And then also, I think I told you, like, I will get injured at some point, which did happen. And that's just normal. And we will manage it as and when it happens. But certainly in my case, I'm able to do some of that healthcare management myself. For patients who are, trying to find someone to work with who's a PT or a coach in the fitness space, it's really difficult right now, because there are a lot of people, there are not many coaches or PTs who specialize in working with people who are hypermobile. It's a very, very niche area. I'm low-key trying to get you to specialize in it. We'll see. But in terms of making this work, I think a really good setup can be if the patient's healthcare provider is able to talk with the PT or the coach, even if they're not hypermobility specialists themselves. And again, that's just a self-proclaimed term often. There's no official exam people take to be able to say this. So whether or not someone's good or not depends on just whether or not they're good. But if a patient is not able to find a person who specializes in this field, certainly having a healthcare provider who's willing to kind of talk to that coach or that PT can be really helpful, because you can be told, like, hey, the patient can't do this, or they can't go above this heart rate or whatever. And you then are able to support them with that. Yeah.
I mean, if you're a good coach, when you have someone who comes into your class environment or into the one-on-one environment with you, you're monitoring them and you're doing tests to see what is their range, what are their limits, what can they do, what they cannot do. Obviously, with a patient who's a little bit more specialized, getting some sort of feedback from the provider to say, look, these are the boundaries and this is where we want to stay, definitely makes a difference, right? And I think what I found with us, obviously you're very knowledgeable about what's going on, which makes my job a lot easier.
Yeah.
But even still, just to get peace of mind for myself, when I give you something new, I've always got you down doing it. And then it's, okay, how does that feel? Is this working for you? Is there pain?
Yeah.
Is there not pain? When you're doing the kind of homework drills that I've given you, you're giving me feedback so I know what's going on, which then gives me more confidence when we have a one-on-one session to say, okay, I can push Alex this way today and we can try get a little bit more out of it, or okay, no, that didn't work so well for Alex. So what's another way we can think about kind of attacking this but thing that we need to overcome to find more tension or to get better positions to perform the movement that we want to end up doing.
Yeah, no, the gold is in the things you're not good at. I really believe that. And I think, again, that's something from kind of the whole like mixed modal fitness type of methodology of like, we have this broad set of movements and all these different things we can do. What am I not good at and why? And addressing that's been key. In terms of working again with clients, I should say, who are a bit more complex, I think something that's worked really well for us is that you don't, as far as I know, like there's not a strict, like this is our 12-week block. Week 1, you'll do this. Week 2, you'll do this.
Yeah.
You kind of, I think I've also made you have to adjust it as you go, but it's felt a lot like you kind of look at me and where we are. And as you said, you modify it from there. Is that correct? Or?
Yeah, no, that is correct. I mean, I think, you're going to have programs where you want to see progression as you go throughout the program, and things like progressive overload and periodization is important, but am I seeing you progress week in and week out? And that's what really matters, and managing that, right? So, if I gave you a strict 12-week program, you probably would have injured yourself in the first 3 weeks. And then you would have tried to stick to it, or I would have tried to force you to do it again, and we would have just kept re-injuring every 3 weeks. And that doesn't work for you. And I feel if you're going to do a system or situation where you're one-on-one with someone, then it is my responsibility to make sure that the service I'm delivering to you is completely customizable to you. Otherwise, as we know in the world that we live in now with AI and stuff, you could just type into ChatGPT, give me a 12-week
I think that happens
program.
Sometimes too, for sure.
This is where the difference really comes in. It's that human connection. It's that understanding your client and making sure that you're working with them to get the most out of it, right?
Yeah.
I don't see you, like, I see you as an athlete, and what are the things that we can do to help you get the most out of your fitness to make you feel better. Like you've been speaking about how because of your back injury, you're not going to be able to do all the normal classes again.
Yeah.
So from my side, I'm going, okay, well, let's do some kind of steady state training programming for you, because that's something you really enjoy. So you're then still able to get that enjoyment out of training.
Yeah.
And continue to move, which is going to make my job easier when you're coming and seeing me on one-on-one situations, because you're now conditioned. And if I'm asking you to hold positions or do some things a little bit more, you're where I need you to be.
And I'm also mentally happier. Like it's people, again, a lot of healthcare providers, they don't understand that for me to not be able to go to the classes I go to means I can't spend time in a way that I like to spend time with my boyfriend, because Dave and I go together. And I am really sad that right now that's just the risk of me doing a movement and pushing myself a bit hard is a bit high. And it's just a good, whether it's good healthcare, whether it's good coaching or personal training or whatever, it all comes down to a risk benefit assessment ultimately. So absolutely, in my case right now, because of this injury, which we'll get into more in a second, but it's made sense just to control some variables and kind of put me off of my, I don't want to get tempted by fun movements in the class, because I'm like a little puppy. I get tempted. I just want to, there's a point when you deal with injuries your whole life, you just get so sick and tired of it. But that doesn't make it go away, unfortunately, which is really, really annoying. And I think I told you this early on too, if you're someone with hEDS or HSD, injuries take longer.
Yes.
So for me, I had my back injury. I think I injured a disc. I haven't had medical imaging. Just that's a decision I've made because of my current symptoms. But if it's not a disc, it's going to be some other dense connective tissue structure in my low back. We know we're looking at like 6 months of doing everything right, which is a long and depressing window to be doing things right.
It's hard to be tied down and, not be able to do the things you want to do.
Yeah, but we're still find fun ways. That's the thing, is it's about finding ways to have fun and to continue to develop that fitness and thinking about why this injury has happened. So in my case, I'm a tall person. I'm about 5'10", and I have long, heavy legs and a long, heavy upper body. And I'm not surprised that after years of not developing good hip flexor strength and good lower abdominal strength, and I would say I'm relatively weak there compared to the rest of me. You're like, yeah, she weak. But I was kind of due that injury, which is annoying. But I'd never been able to find a way to successfully strengthen the lower abdominals and hip flexors for me, because it's hard to do these things.
Yeah, no, it is very difficult. And, you follow traditional fitness things and sit-ups is going to take care of everything.
My neck would hurt. That was my neck would get so painful and I'd have headaches. And I was just like, this is not for me. And then
you stop, right? Because it's like, this isn't working. It's causing me more pain. It's not helping me. It's not assisting me. Yeah. And I think in the beginning of our journey, there were some things that, you know, traditionally I would give this to someone and it would be like, cool, that's going to sort out the issue. We're going to strengthen there and everything will be fine. And then you'd come back to me and you're like, that's not really working for me.
Are there any examples you can think of?
I really like the drill where we do the hollow hold.
Yeah.
And
I know the one.
yeah, we're doing the hollow hold. We've got a PVC pipe above your head.
Yeah.
That PVC pipe is connected to a red band, which is connected to the rig. And Alex has to hold her hollow hold position, which is going to require her to be tucked through her rib cage and her hips. And then she pushes down on the PVC pipe. But obviously this was engaging your neck quite a bit. And in the beginning, it was too much for you.
Yeah.
Right. So we scaled it down. We started to do the dead bug, which again has got you in that crunched position, but we were able to keep the hands up. So we're still looking for that engagement through the neck, but we're dynamically moving the leg now. And we just strengthened you through that way. We then kind of would come back to hollow rocks, but without the movement of the arms. Hollow rocks being moving back and forth. So there's some dynamicism again, but it's not that push down, which is aggravating the neck. And we just slowly built you up through there. And we're at a point now where if I give you that drill, you're able to do it and you don't have that pain.
No pain, pain-free. And I think like many people who are hypermobile, and you do see this pattern in people who are kind of that hypermobile but sporty type. And again, there are people who their health and their bodies are affected in different ways. But for the hypermobile people who are kind of able to go to the gym and, you know, carry on with some physical activity, very often they call it like coat hanger pain, or they'll hit, you see me hitch my shoulders up all the time. And I think that's probably what was causing some of my issues. And learning and being able to develop that scapular control. We've worked really hard on keeping my shoulder blades where they should be and finding my lats and engaging those. Like that has been instrumental to my success, I'd say, certainly so far. Thinking about, again, like risk and benefit, because I feel like that's something that coaches always think about, certainly. What's the benefit of this exercise? You know, what's the risk? And looking at it from that perspective. We have talked about different health things too. So I've told you, I love rowing on the machines and different cardio things. I was a swimmer growing up. I like my quiet time out. Don't have to talk to anyone. Sit on rower time, listening to like Bass Hunter and really embarrassing music. But I want to potentially look at doing some relatively just amateur competition goals. And again, a lot of people will say, oh, well, you have HEDS or HSD, you know, it's not safe to like push yourself physically. Again, everyone's situation is different. My healthcare providers and I agree that it is fine for me to do that. But I had a really great talk with one of my doctors, and he agreed with me when we discussed this that it would be sensible for me to, example, get an ultrasound of my heart just to make sure that it's okay, because I like doing long distance pieces. And it's nice sometimes to have other pieces of information just to lower the risk further. So I guess what I'm trying to say for anyone listening to this is just everyone's situation is so different. And it's, for me, like the magic, the Triforce, if we call it that, from like Legend of Zelda, the thing that makes really good coaching outcomes work. And my situation's a bit different because I'm healthcare provider and kind of client together. But it's having the client, the coach, and the healthcare provider able to talk and communicate. While you were speaking earlier about some of my shoulder instability issues, I was thinking of a patient that I've had recently who's actually working with another coach on ways to strengthen that shoulder and prevent dislocation. And this is someone who's had a history of repeat shoulder dislocations. And I saw her the other day actually at the gym, and she was so excited because she's like, Alex, I've gone like X amount, I can't remember how many months, but she's like, I've gone months now without a shoulder dislocation. And it goes to show, like, yes, there is risk to doing strength training for this person. They could absolutely, you know, if they are given an exercise that's not correct for them or not safe, or they even just, they're doing everything right, but maybe they slip or something happens, there is risk to doing exercise, but there's also risk to not doing it. There's a lot of risk to sitting on the couch.
Right. There's risk sitting behind a desk all day. Never doing anything.
Or lying in bed. There's,
you know, I think, bit controversial, but you go to doctors, whoever, and they point out the risks of doing something. I don't think they ever point out the risks of not doing something. You know, and that being exercise, right? We speak about how I see you as an athlete, I'm your coach. If we had a talking professional sports relationship, my job as a coach would be to get you on the field, right? Because I need you to perform as an athlete. my job as your coach for one-on-one is to keep you moving, because I know mentally it does a lot for you.
Yeah.
And also I know that through the work we've done over the past 6 months, right, you have felt a lot better in all around your fitness by simply just focusing on finding tension points in your body. Right. Absolutely. Now, when you're sitting on the assault bike or echo bike, air bike, you know,
the bike with the arm thingies.
The bike with the arm thingies, the worst bike ever. You know, you're able to now feel better tension in your upper back, which is something you never felt before.
That used to give me shoulder pain. So I would hate the bike with the arm thingies, echo bike, whatever. I would hate it because I would get this grinding pain in my shoulder. And when I would tell coaches about it, they were confused. And again, it goes back to my shoulder instability. I've never had a dislocation, but my shoulders are hypermobile and I have a lot of history of injury and probably some degenerative changes to the tissues there. And it would feel like almost like rubbing sandpaper inside my shoulder. Like it felt awful. And being able to be on the bike recently in a workout and actually feel that tension in my upper back and across the shoulder girdle, that was really exciting for me. Like that brought me joy. And I know people get joy in different ways, but I was in that workout and I don't think anyone's been so happy to be on a bike doing that.
And I think for a coach who's dealing with someone who, you know, has specialist needs, it's understanding that something as simple as that makes a huge difference.
100%.
You know, if you're dealing with a perfect athlete who, say, comes to you because they want to learn how to do bar muscle ups. I have that, right? I have athletes who just want to learn the really cool gymnastic skills.
Yeah.
And when they get their bar muscle up, that's their level of like, yes, that's the best thing ever. But when you have an athlete like yourself or like me when I was coming back from my cancer, the fact that I was able to do 20 unbroken lunges without feeling like I was going to fall over, that was the best thing ever at that point, you know. So it's about coming and meeting your athlete on their level and getting the most out of them. And that can be the smallest thing, you know. I remember when you told me about the bike and how happy you were. And I thought to myself, I was like, well, I wasn't coaching you for that, but I'm glad it worked, you know.
No, it made a huge difference. And
so,
I think it's because of the positioning of the shoulder blades I have gained muscle mass. I've been checking out my back in the mirror, I'm going to be honest, but it's really, I think, got my glenohumeral joint. So what people think of as the shoulder, I think it's got that in a slightly better position now, where I just have that joint moving as it should because the shoulder blade is a little bit more secure because of that muscle mass. Can we talk about tension? Because I feel like this is so important. And I hear you once a week, I hear you like 100 times be like, tension, tension, tension. Like, what is tension? And when you're working with a hypermobile athlete or a hypermobile client, like, why is tension important?
For me, tension is important when we look at gymnastics in terms of the fitness world, as keeping the body tight allows my muscles to work together in the chain as efficiently as possible to perform the outcome that I'm looking for. Tension also is really important because it allows me to understand where the safe end range of a movement is.
100%.
Right? So if I have no tension and I can't find tension when performing a specific movement, I have no idea that I'm going past a safe point.
It's like skiing off piste. Like, you know, like you want to ski down the hill. You don't want to go through the trees. It's like driving on the road. You don't want to drive like off the road. It's like that. And when I first started really getting into fitness, we talked about this before, this obsession with full range of motion, you know, like the ass to grass squat. I was smashing the front of my hip so hard, like going all the way down, all the way up. Or when I was hanging off a bar, I was just forcing movement through the front of my shoulder so aggressively simply because I could. And I thought I was doing a good thing, but this was like a decade plus ago because I was doing the full range of motion. But sometimes full range of motion is bad.
100%. Because that full range of motion for yourself is not a safe range of motion. You know, we have very different problems when it comes to gymnastics, right? And you see that when I demo movements for you, because I can see you kind of looking at my shoulders and thinking, oh, they're bad. But I have too much tension in my system because I have very immobile shoulders. So, you know, it's very easy to identify when I'm going too far. Because straight away my shoulders go, whoa, that's a bad idea. Why are we doing that?
It just feels tight, right?
It feels really tight. And sometimes if I push it way too far, I have a bit of pain, either in the shoulder or a lot of times when we're doing that kip swing and I'm going into the arch, I feel it in my lower back. So you'll very seldom see me over arch, because immediately I get feedback from my body saying, oh, that's a bad place, don't go there.
Yeah.
The biggest thing that I wanted to focus on with you when you came in was that there was no notification to you to say, hey, we've gone too far. You're not allowed down this road. You need to come back, right? And we would just keep going down that road. So what we had to do was build in those tension points for you and create them for you so that you understood where they were. And now you know where to go, because you've taught your body that, hey, this is the tension point that I need to get to. And I think that's a downfall for a lot of coaches. We can very easily identify when someone cannot hit the full range of motion, but sometimes we are a little bit lax or don't always see when someone goes past the full range of motion, and then can potentially lead to unsafe places. And since working with you, I'm constantly now in the gym in my group classes. I'm like, no, that's too far. You need to come up out of that squat, or because, you know, now it's a lot more obvious to me and you can see it. I always used to see it on the gymnastic swing on the arch, because you see a lot of, especially ladies, who really go too far through the shoulder. So I was always aware of that. But then, you know, after the conversations we had, it was like, oh yeah, this shouldn't be actually happening in the squats. Whereas before, for someone who's got so much tension, it was like, oh, that's an impressive squat. And then you go, oh, actually, no, hold on. We're putting ourselves at risk. Obviously, if it's trained, you know, like you're going to have a weightlifter who trains to that range of motion, because part of their job description is to get under the heaviest weight possible, which requires them to catch that weight as low as possible. But they're trained in that position.
Absolutely. And they're not doing 1 rep max every day. No. So even if I, you know, when I ollie lift, I know I haven't been doing that much lately. We'll talk about the back in a sec. But if you're doing a 1 rep max, you're going to get shoved down. And it's okay, I think. And again, people will disagree with me on this, and that's fine. But when it comes to fitness for the hypermobile person who wants to do it in a relatively high level, and again, I'm not a professional athlete by any means, but I really enjoy the sports and the activities that I do, and they're important for me. But when it comes to doing a 1 rep max, you will get shoved down by the bar. And yes, you have to fight it. You have to have that technical expertise 100%. But if you are hypermobile in your hip, you're going to go down potentially. Absolutely, you need to be able to come back up. But the key thing here is that you shouldn't be doing 1 rep max every day. If you're doing a big volume of those squats and you're being shoved down, you know, then it's a huge issue. Or again, if you're doing a 1 rep max and your knee moves in a tiny bit, you're dealing at the maximum capacity of your ability to move. And again, that type of technical quirk, I think, is tolerable in that very, very limited rep range. But if that athlete has those knees diving in, day out, that's going to cause huge problems. So I think, again, like, I'm so grateful I had the time I had working with these professional athletes, because it taught me to think about, you know, risk benefit assessment in different rep ranges or different volume ranges for different types of fitness.
Yeah, I mean, definitely. And it's applying that, right?
Yeah.
Because at the end of the day, I think trying to avoid something is also going to lead to disaster in a way. You know, sometimes you can't help it. Sometimes in everyday life, you're going to get forced into a position or a range that you're not supposed to be. But the better prepared I've made my body to handle that, the better off I'll be.
Absolutely. It's whether you like it or not, eventually that end range will come for you. And we want to be careful. This is a question I get asked all the time on social media. Like, should I be training movements? You know, should I let my elbow hyperextend or whatever when I'm doing finishing a push-up or something, I don't know, overhead press or whatever. And the thing is, look, ideally, you're not going to be going deep into that hyperextension end range all the time. But if you do that on a low volume set, or it's being done in a controlled way, ideally with the supervision of a coach who's knowledgeable, then it's possible that there may even be some benefit when life forces you into that position and you have to put your arm out to catch yourself or something. I like the saying from Spider-Man, this is really random, but with great power comes great responsibility. With great range of motion comes great responsibility. And I have quite muscular shoulders that are kind of, well developed, because I need to be able to stop my shoulder from going there or being prepared for when it does inevitably go into that end range. So that's how I like to handle it. And again, there will be some people listening where that's not safe for them. And if that's not safe for you and you've been told that, do what's safe for you, okay? But if it is safe for you to train, I think there are ways you can certainly try and improve your fitness. Let's talk a little bit about kind of, we've touched before on kind of dysautonomia, because a lot of people, myself included, will find that they feel a bit nauseous or a bit sick when they're exercising. And this is because some people who are hypermobile, they get lightheaded when they're changing body positions. So I have orthostatic hypotension. And what that means is that when I go from being basically in a horizontal position to being upright, or if I'm doing that repeatedly, I previously would start to feel really unwell. I still will sometimes get a bit dizzy, although it's not too often for me. And I have to say that I think my fitness journey has actually really helped me with that. Can you talk a little bit just about kind of blood flow diversion and how that can affect body functioning, just in a general sense?
Yeah, I mean, in a general sense, if we looked at mixed modal training, so let's take a workout where I'm going to do a 400-meter run.
Yep.
And following that 400-meter run, I'm then going to go into a set of max pull-ups.
Yep.
Okay. If I started off with the max pull-ups and did no running, those pull-ups, I would, let's say, hit 10.
Mm-hmm.
I then go on my 400-meter run, and when I come back inside, it's a little bit harder to get those 10. Obviously, there are many reasons for this. My heart rate's a little bit higher. I'm a little bit more fatigued.
Yep.
But one of the reasons why this is happening is because all of my blood flow has been diverted to my legs, right? Switching off, keeping blood in the essential places it needs to be. But my body goes, hey, we're not really using our arms. The muscles in the legs are really screaming out for more oxygen. So we're going to pump as much blood down there as we can. You come inside from your run. You've just sneaked up, ninja'd your body and said, oh, wait, hold on. We're going to jump on the rig and we're going to start pulling. And now your body immediately goes, oh, wait, hold on. We got to shut off blood flow to the legs and now pump it all the way up to the body.
And that's a hard thing to do. I just want to say from a physiological perspective, like that is, I'm amazed that I'm amazed that we're functioning all the time. The body's incredible, but getting blood flow from your legs up is defying gravity, literally.
Really, really difficult. And that's one of the kind of keys to the secret sauce about mixed modal functional training. You know, CrossFit is that we have this type of training where, yes, you're working your muscles, but you're also working the blood flow, the central nervous system, telling it where to send blood, how to do this, how to do that. So with the type of training that you've done over the years, it kind of, in my head, makes sense. And we had a conversation about this after one PT session, why you would feel a little bit better prepared to now handle that dizziness that you would be used to from going from down here to up all of a sudden. Because through the training you've done, you've trained your body to better handle and process that.
Yeah, just to literally cope with it. I think, again, and I know this is controversial stuff. This is just my opinion on this as well. But although there are different ways to manage this type of dysautonomia, so the umbrella term is orthostatic intolerance. Some people have POTS, some people have orthostatic hypotension. There are medications, and people should ideally be under the care of a cardiologist and checked out. I love safety. I'm very keen on that.
Yeah.
But I have to say anecdotally that doing types of training which have focused on, as you say, like that diversion of blood flow, even though I didn't know that's what I was doing at the time, has, I think, at least it's correlated with a really big improvement in my symptoms. I remember a workout I was with an athlete's parents, actually. They were in like their 50s at the time or 60s, and they were doing all these burpees. And I was trying to do burpees with them. I was in my mid-20s. I thought I should absolutely be able to do this.
Yeah.
And I just felt so like sick, and like it's this nausea and lightheadedness. And again, we want to be safe. We don't want people passing out, and some people will pass out. So again, these are the people where they need to be doing exercise like on the floor in a safe and controlled way for them. But in my case, I knew I wasn't going to actually like lose consciousness. I just felt gross, basically. And for me, it was always one of those like, why am I so bad at this? And I've just always been one of those people where I look at what I'm bad at and I'm like, can I find a way to get better at this?
Yeah.
So I thought it was just that because I'm tall, my heart rate is maybe getting a bit spiked from, changing body position. It's a long way down.
It is a long way.
Okay?
Yeah.
And I became obsessed with burpees too, technically. I'm like, am I doing the technique right? Like I wanted to know everything because I like to try and find ways to be better at the things that I'm not good at. But I started to do burpees in a more slow and controlled and casual way. I became more aggressive with scaling again. So I would just scale the numbers. I wanted to feel safe while I was doing them. I started also going to the gym and being on the ski erg because I noticed I got the same feeling when I was on the skiing machine.
Yep.
And again, we have that upright body position to that kind of bent over body position. And I was feeling like, I was feeling woozy. But what I found helpful was actually using my chest strap heart rate monitor at the time, figuring out, because of the rowing I'd done previously, I know my kind of like steady state heart rate range where I feel really safe and really comfortable, making a rule that, okay, I'm not going to pass this heart rate range. And then doing these kind of slightly longer pieces, like I do 5 to 10 minutes on the ski machine, really slow and chill, just having that heart rate there. And over time, I think that's absolutely improved my ability to port blood around my body.
Yeah.
One thing I want to touch on too with blood flow and training as well is, so we haven't talked that much. We've talked a fair amount about hypermobility, but you, like, again, you're not a specialist in this field yet, although I absolutely think you should become one. But one of the big issues people have is getting this blood flow moved around their body in a way that helps their body do what they need to do.
Yeah.
So there'll be those people that stand up and get dizzy or this type of thing, as we've talked about. But another common symptom is that people will feel unwell after eating. And that's partly, there can be different reasons for this, but one reason can be that their blood is kind of going to all be concentrated in their digestive system. Their body's focusing on that. They then go to do something like, for example, stand up or do something physically that has some physical exertion element to it. And they will then feel really unwell. So I think finding ways to kind of safely, I tell my patients we're like microdosing cardio, but finding ways to do it where we're really safe and in control is critical. We bonded early on a little bit over rowing and steady state training. I've tried to tell people what it is. I actually have a guide on Amazon where I tried my best to explain it from a uniquely hypermobile perspective, might I add. But tell me a little bit about steady state training and why it's so helpful for health reasons.
Steady state training is really helpful because it's working your aerobic system.
Yeah.
So that's everything to do with our breathing, your cardio, kind of your respiratory system.
Yeah.
What's really great about steady state training, if you're looking at it from a kind of scientific way, and I'm not really that scientific, but the more cardio, the more steady state training I do, the better my blood flow, or the more my blood flow has to work.
Yeah.
Right. And what happens is the capillaries that are attached to your muscles grow because your muscles demanding more blood.
Yeah.
We know our bodies are very smart, right?
They're so adaptive.
Goes, yeah. And it goes, oh, cool. This muscle wants more blood. I'm struggling to send it that blood with the one capillary to that muscle. So I'm going to add in another 4.
Yeah.
Right. And through time and doing more and more steady state training, your capillaries grow. So the delivery of blood to that muscle becomes better. Right. It's like, getting the Uber driver to deliver you one massive food thing and expecting him to fit it in for a feed of 10 people. It's not going to happen. You're probably going to have 3 Uber scooters rock up instead of just the one.
Yeah. You want that delivery to happen in an organized way.
The one scooter going back and forth, they're going to put it in 3 scooters and send it off to you once.
Yeah.
Probably a very weird way to explain that. I had some...
It was slightly confused me for a minute, but I do get it now. It's about the efficiency, basically. How efficiently can you deliver what the muscle needs to function? There is ample research. Again, if you want to read about steady state training, I encourage you to do it. Sports gets lots of money in research. Hypermobility stuff does not get so much research. So I have to say that I do often end up role-playing, pretending that I am a professional athlete and looking at what they're doing and finding ways to apply it to my own health. But when it comes to this type of steady state training, we see that we get this improvement in efficiency of the cardiovascular system because of the capillaries that are being built. I have to say one reason I fell in love with steady state training too is because it makes me feel warmer. So I get really painfully cold if I don't do cardio, which is why we have the bike in the flat. We have a tiny flat, but I've insisted on a bike in it. If someone doesn't do this type of training, so let's say that they're not doing any cardio, the general message out there for people who are hypermobile is strength train. And I love strength training. I love all fitness. But if someone's making their muscles bigger, but they don't have those delivery drivers or they don't have the infrastructure, as I think about it with the capillaries, what happens in that situation?
Well, if we carry on with the metaphor.
Let's do it.
Right. You used to live really close to your favorite eat out place, and your driver only had to take 5 minutes to get to your house.
Dream situation.
Right? Order as you need it. the more strength training you do, the bigger your muscles get. Strength training doesn't kind of entice that cardiovascular response that we look for, that increases the capillaries, but your muscle grows. So what happens now is you had to up and leave, you had to change flats, you now live 15 minutes away from your favorite eat out place. So when you call to get your food delivered, it's now going to take that much longer to get to go where you need it to be. So I might be a lot stronger, but when I actually have to use those muscles, I now want to get my food, it's not as efficient as coming to me as it was before. Whereas if I strength train, right, and I think about doing cardiovascular work at the same time, right, we never want to specialize into one more than the other, because as a human, we need to be able to get our heart rate up, but we also need to be resilient to handle external loads, right? We want to be doing these things together so I can be as efficient as possible. Whereas if I just strength train, it's not going to help my cardiovascular system. It's going to make me stronger, but those muscles are not going to be able to work for as long as you were hoping. Right? It's kind of like, take a bodybuilder, ask him to walk up a flight of stairs, he's probably going to be just as out of breath as an untrained person would be. Right? It's the same as you take a marathon runner and you ask him to lift heavy weights, he's going to struggle as much as an untrained person would. If you find someone who's in the middle, who says, they do this mixed modal training that we've been talking about, they're not going to lift as heavy as the bodybuilder, and they're not going to run as fast as the marathon runner over that long distance, but they will perform both of those tasks a lot better than an untrained person would, if that makes sense.
No, that makes complete sense. It was making me think of actually the whole concept of GPP, as you call it. I'll get you to define that in a second. But no, when working with patients or clients, I think it's critical to always think about like what they need to do with their body. You know, do they need to carry groceries? Do they need to go up a flight of stairs? Like, what does their life require of them? And the best approach for most people, as you said, is going to be to do a combination of different types of training. It's not strength is good and cardio is bad, or even aerobic cardio is good or anaerobic sprinting is bad. You know, everything has its role and everything can be scaled for the most part in different ways. I think people forget this. Like I could make a strength program that my 92-year-old grandpa could do. I can add in a cardiovascular component to it, and I'd add in some balance and proprioception based exercises as well, because I think that's kind of how I just really try to simplify the fitness world and think about it in my brain when plugging things together. When it comes to trying to find ways to just improve people's overall health, can you tell me a little bit about GPP and how that kind of guides you in management?
So GPP, we think general physical preparedness. And that's basically, if I'm looking at a client in front of me, as you've just been saying, how can I best prepare them for their day? So one of the things that's really important to us with the group coaching and training that we do at our gym is making sure that people are very strong at getting up off the floor, right? That people have strong legs and that people have a strong cardiovascular system. So burpees get a bad rap, right? But burpees are really good for you because if I'm able to burpee, I'm able to get up off the floor. And when I'm younger or middle-aged, if I can do a lot of burpees, this bodes well for me, because as I get older, I maintain the mobility to get up and off the floor. I maintain the strength to get up and off the floor. And that means I'm less dependent on other people. So if I'm at home and I fall over, I'm able to get myself back up. And I'm now not in a situation where I'm potentially stuck there until somebody comes to visit me, which could be very dire. Right.
It's with the fall example, we'll talk about the back injury a second. At some point I got injured. We've been figuring out ways to manage it, but I fell recently as well. I fell really badly running for the train, and people were offering to help me. Like, that's, it's bad when people are like, are you okay? And I have to say, having fractured my wrist previously, I was so expecting to have fractured something 100%. Like, I was really worried. You've seen me, it was this hand actually, but we've been careful with it because I was so nervous. But I didn't fracture it. And I do think we will never get a study funded on this. If you're listening and you want to fund a study, please do. But I do wonder if doing burpees for years has helped me get better at just dealing with my body weight through my wrist and through my hand and coming out of that uninjured in that kind of general physical preparedness sense. It supports me in living my life and dealing with what comes up, whether that's falling over or at the tender age of like 33 or, other things that my life requires. To touch on the back injury, I have to say that the core strength that we've been focusing on developing for me, as we talked about earlier, it's something I know I've always been not as strong at.
Yeah.
And I look at it as a way not only to try and achieve some of the sporty things. Of course, I have goals. Okay, I like my fitness stuff, but it helps me to kind of make sure I can work long term and make sure, if I ever did become pregnant or had something physically challenging happen to my body, have a health setback of some other kind, that we've built up that buffer of fitness high enough that I then have a place I can fall from.
Yeah.
Instead of going from kind of just functioning to, being really unwell, I'm going from being relatively very, athletic or physically fit to then less so. And it just buys you time and the ability to come back.
And I think, it's very easy to point out examples that are based off of strength training.
Yeah.
If I have strong legs and I'm able to squat, chances of me being able to, I say this to people all the time, sit up and get off the toilet by yourself without having to worry about getting help to do that or having to have special things kind of fitted in your bathroom.
Yeah.
But it doesn't just come down to that. The stronger your cardiovascular system is, the healthier you will be and the better you'll be able to fight off some of the kind of chronic diseases that we start seeing to come into play. I had a guy who I worked with, this was just after I got my cancer. I think it was around 2017 for him. We both did CrossFit because we worked at a company that sold CrossFit equipment. So we both believed in this thing, and he got really bad blood clots.
Oh my God.
They went towards his heart.
Wow.
And he got admitted to the ER, and, he's on blood thinners to this day, and he has to be very careful about what he does now.
Yeah.
But when he came out of the whole ordeal, his doctor said to him, if you were not as fit as an individual as you were, you would be dead right now.
Wow.
Right? So staying healthy in all aspects and not just trying to be as strong as possible or kind of as fit as possible, able to run as far as I can, but being right somewhere in the middle is this idea of GPP. I'm not specializing. I'm being generally physically prepared for anything and everything that comes my way, which for people with hypermobility is probably the best thing you can be.
Oh, absolutely.
Because you deal with so many different situations where you're going to be tested by things.
Oh, for sure. These unexpected movements, you're just more prone to them because you might step funny or, things happen more often. No, I have to say, when I work with patients, and I try and be that bridge, so, there's like a gym facility in my clinic. So I will like trial exercises with them. And then I try to refer them and then communicate through that referral, as you know, from having worked with my patients. But it's for me, it's about finding almost that fitness multivitamin. That's what I call it. So it's like, or what's your broccoli, as I like to say. Yeah. So it's like finding that little workout, whatever it is, where they're able to do something, it feels good, it targets some of that GPP aspect or some of that kind of health protection. What are they prone to? Do they have a history of ankle sprains that we need to address, a history of getting, lightheaded and they want to try and work on their cardiovascular fitness, or maybe they're like me and they have shoulder issues and they need some more muscle to help with that stability there. But finding that like Alex's perfect multivitamin of a workout or whatever, I think that totally is like one of the best investments and interventions someone who's hypermobile can make, especially if they're a young person and they are going to the gym anyways. Like, why not just do it in a way that benefits your health long term?
100%.
Sean, thank you so much for being with us today. Is there anything that you'd like to say just briefly in terms of like, I guess, stuff that you've learned from working with me, or future considerations for people who are hypermobile? I hope I've inspired you to want to work with more hypermobile clients.
Yeah, definitely. You've inspired me with my one-on-one coaching and helped me to think of things different ways, and it's been really great to work with you.
Thank you.
Because I feel like it's forced me to kind of look at things differently, which helps me to grow as a coach. I think from my side, the biggest thing is that if you are a little bit nervous and you are out there and you're a bit tentative about doing training or getting involved with something, whether it's because you are hypermobile and you have previous, things that you have to worry about, or like myself back in the day where I struggled coming back from chemotherapy. Start small. It doesn't have to be this massive crazy thing that you do. It can be the smallest thing. And if you find the right person who aligns with you, who you get along with, who you have a connection with, they can really help you through that journey. We've been talking fitness, and I just want people to take away the idea that fitness could be going outside right now and walking around your block and coming back inside.
Or even just getting up off the couch.
Getting up off the couch 10 times before you decide to go walk around the block.
Or even twice. You can scale things infinitely, and there is usually some way to move for most people. And I think absolutely, for patients or people out there looking to exercise, that's great for them. For personal trainers and coaches in this space as well, what I want to say is, like, don't be scared of people who are hypermobile. Talk to them, learn about the relevant health issues, try and talk to their healthcare providers if you can. But I'm convinced that the best way we can help a lot of people is by having healthcare providers talk with personal trainers and coaches, and then talk with clients, and we all work together.
I think that open communication chain, right? We are constantly talking at the beginning of our sessions about how are we feeling about this, how are we feeling about that, and we're just building on that every week. And I'm taking what you know, and I'm taking kind of how I see you responding to things, and I'm letting you know, okay, these are the things we should look out for, and then you're giving me constant feedback, and it's just this feedback loop. And that's why I like to be called a coach, right? Because I'm not just having you come in and say, all right, this is what you're doing today, you're going to do that. It's collaborative. And if you're doing that with your fitness, you'll be in a good place.
No, absolutely, Sean. Thank you so much again for your time. It's been a pleasure to have you on, and I hope to have any of you listening or watching join next time. Be sure to subscribe, be sure to leave a review if you can, and keep an eye out for my upcoming book. Take care. Bye.